see lots of new faces here, so welcome, welcome. If I'm not Idaho, great. I'm not sure how many of you have taken any of my trainings before. Toronto. Oh, hi, Dorothy. Great. How long is the webinar? We'll probably be going for 45 minutes to an hour. It'll largely depend on the number of questions that we have to answer. As well, Alberta, New York, South Carolina, Okanagan Valley. Great, great. So some Canada, some states. Anyone not in Canada or the United States here today? The time zone might not be that appealing to. Lincoln, Nebraska. Cool, great. Well, welcome, welcome everyone. It's great to have you on board here for this training. So I'm going to go ahead and get started. Venice, Italy. Yay, welcome. Shentai massage, very good. So does that mean you're a shiatsu therapist? I have a shiatsu is my baby, my first modality. So I have a real soft spot for shiatsu. Anyways, welcome to the training. So the training today, I'm going to talk to you guys a little bit about the different instrument-assisted soft tissue treatments. And I'm going to talk a little bit about the history of the treatments. I'm going to talk about the similarities and the differences of the treatments and how that applies to you in your practice as a practitioner. I'm going to go into the different tools that can be used. For the most part, I will continue to refer to this as GUA SHA because I am first and foremost a shiatsu therapist and an acupuncturist. I've also studied Thai massage, osteopathy, reflexology, movement therapy, martial arts, Pilates, a lot of different techniques. And I have a university degree in psychology and pre-medical sciences as well. So I have a very blended East and Western knowledge. My practice always comes from a meridian base. So, which is Eastern medicine, Chinese medicine, Japanese medicine, meridians. But I like to layer the science on top of that because I think it's really, well, I think the most progressive way to practice is to take what the ancients have learned thousands of years ago and apply, the science that we understand today. Also, from our clients' benefit, it helps them to understand when we speak to them in a language that they can understand too, as well as you guys. So I know some of you may have some Eastern medicine training. Is there anyone here who's had training in the meridians or acupressure, acupuncture, shiatsu, Thai massage, anything like that? It's okay if you don't, because like I said, I'm going to speak in Western and Eastern perspective. So I'm not going to use overwhelming Eastern medicine terminology. So I'm going to go ahead and get started here today because we've got a good group going and it's been a few minutes. So if anyone's coming on late, then they can just join us when they come. So first things first, I'm going to share my screen. So just bear with me 1 second. Okay, that's not quite what I want. Let's see what happens here. Okay, so give it a second. The question is, can you see, does my screen now say GUA SHA with the pink wand on it? I am seeing nods. This is good. All right. I'm also using my old computer because it has a better camera. So, okay, great. All right. Why did you do that? Let's go back to the first slide here, and I'm going to run the slideshow. And I'm going to put this chat, which is right in the middle of my screen, up in the corner. There we go. All right, great. What just happened there? Okay, perfect. So we're gonna, like I said, we're gonna talk a bit today about GUA SHA, about instrument-assisted soft tissue manipulations, and about GUA SHA, or sorry, Graston technique. So I'll just first start off by prefacing that Graston technique is very highly regulated, it's trademarked, and it's a registered treatment modality. So I don't know if anyone here is trained in Graston technique, but it's something that I have to be extraordinarily careful talking about because it's just very well protected, and that's one of the standouts for the three techniques. That's one of the standouts, is that Graston has put a lot of emphasis on the specificity of their technique, how you can talk about it and what you share. So that would be that, and they've also trademarked their instruments. So these are the two kind of key points that I just wanted to bring up right from the beginning. So you'll hear me say IASTM, which is instrument-assisted soft tissue manipulation. And that's just a short form for basically all of these techniques. But mostly I'm going to use the term GUA SHA just because that's where, that's where I'm comfortable speaking as well. So I'm going to go ahead. So we're going to talk about the three techniques. I'm going to describe the three of them for you, talk about the similarities, the differences, the tools, the techniques, and the approaches. And I'm going to do my best to get this in under an hour, which should be good. So we'll have, I'll talk to you a little bit about the program I have together, but also I'm going to have a Q&A period at the end where you can ask any questions that you have. If you do have a question, you can put it in the chat. And it's not super easy when I'm running slides to have easy access to the chat, but I will do my best to keep my eye on it and keep the questions answered as we go along. If I've ignored your question, it could simply be because I know that I'm going to answer it at the end and we can finish at the end. Sometimes when people unmute themselves and ask questions, it takes me a little bit off track of what I'm doing, and I lose my focus. So anyways, forgive me in advance. I get a little single-minded on these things. Okay, so you can see the image here. So this, when I first started teaching these modalities, I'll just tell you a little bit. In 2008, I was asked by the shiatsu and acupuncture school that I studied at to start teaching cupping GUA SHA, moxibustion, and other adjunctive therapies. And I was handed like a page of notes for each of them and was supposed to teach off of that. And for anyone who has studied with me before, you know that doesn't cut it in my world. I think it's really important for people to understand where things came from, and also how they've been used, for us to understand how they can also be applied today. So this really struck me when I was going through the archives to find this picture of the ceton, because this is one of the earliest Western medicine applications of this medicine. And so this idea of scraping comes back to early medicine. In China was one famous text called the Yellow Emperor's Classic, and the Eber's Papyrus in Egypt. And these two books they came out at a similar time. So there's over 2,000 years of history of medicine that originate in these two areas of the world. So in the West, it was accepted that the body could only hold one illness or one pathogen at a time, which we know today is simply not true. We have sadly seen that, and we see it every day in our lives, the number of people who have a multitude of conditions in their bodies. But this started the experimentation on healing, where they would create these secondary illnesses in the body. So this is a cetin that they used to apply. For example, in this picture, you can see the person has an eye condition that you can see the description of the running eyes and the fullness of the eyes. So it was said that in this picture, this person had an ongoing eye infection. So the way they treated that was to create a secondary trauma in the body. So they pierced through the spine with a cetin and clamped it to create a secondary infection, or to create an infection to cause the body's immune system to focus on that injury. And so originally it was thought that if the body was distracted to another injury, it would give it the first injury a chance to heal. So I just like to show this kind of stuff because I think it's really fascinating to see where this medicine started and how far we've come, but also how many of these ideas we're still using today. So GUA SHA came, it basically came out of this idea that if we created an injury on the surface of the body, that it would cause the body's own immune system to respond and react and create a healing situation. And in fact, GUA SHA is still used that way today in traditional Chinese medicine techniques. So this would be the very, very first difference between GUA SHA and the instrument-assisted techniques, is that GUA SHA is used to cause a fever or to induce sweating in the body. So before I go into the actual description here, I have a couple of examples of that I've seen in my own practice. And so one case for this would be if you ever see the clients who, or you know anyone who never really gets sick, like they never really crack a fever, they just get kind of malaise for a long time. So they get kind of half sick, maybe a little bit clammy, a little bit sweaty, but never at the point where they really get like a full-fledged cold or a full-fledged fever. And in this day and age, a lot of the time we think that's a good sign. We think, oh, I have a great immune system. I never really got sick, but you were half sick for 4 times longer than you would have been if you'd actually gotten fully sick. And the reason for this is because the body creates a fever because bacteria, virus, and fungus can't survive in high heat. They can't. So that's why the body creates a fever. So it's good for us to get a fever as long as it's not sustained for a long time and causing obviously brain damage and other issues, and we have to watch dehydration, etc. But that fever is what causes the body to kill the bacteria, virus, fungus, mold, parasite, less so. They need a lot of heat. But so when GUA SHA early on, and we'll talk about the ideology and that of it as well, is one of the tools it was used for. The word GUA SHA actually also describes the petechia, or the redness, which translates Sha as cholera, right? So this was the illness, one of the early illnesses that GUA SHA was treating, is that they would induce a sweat. They would induce heat on the surface of the body, so the body would get more heat and it would fight cholera. So this was the #1 treatment for cholera in the early days of that outbreak a long time ago. So GUA SHA, which is instrument-assisted unidirectional press stroking of a lubricated area of the body's surface to intentionally create transitory therapeutic petechia, representing extravasation of blood in the subcutis. So there's a lot of words there. So Ari Nelson is a pretty well-known, she was one of the first acupuncturists, kind of white, European acupuncturists in North America. She's from New York, actually. Still alive, still teaching. And she has a book on GUA SHA, and she created this definition. So one of the points that I'd like to make here, again, that is a major difference between GUA SHA and the other forms of instrument-assisted techniques, is that GUA SHA is specifically treated in one direction. And the one direction is always from the center of the body outward, and it's always from the top down. So if we're doing GUA SHA on the body, we're always going to start around T1 area, and we're going to go out the neck, out the shoulders. And there are reasons for this. And one of the reasons, or two of the reasons, I think are very valid today, and one of the reasons may not be as valid today. I like to kind of explore all of it because, of course, I'm that person that sits in the class and has my hand up all the time, right? So if you're that person, I can totally relate to you. And that person is always in my class saying, I'm sorry, this might be a stupid question. And I just say to you, there are no stupid questions. The reason that I am where I am today is because I asked a lot of questions that I also thought maybe are stupid questions, because I need to know why. I need the answers, right? I can't just scratch over the surface of things. I gotta understand it. So it's okay. Why is this GUA SHA? Why are we only doing it in one direction? Like what is the reason for that? Why wouldn't we do multi-directional GUA SHA? You know, like why? And so I looked at that and I said, okay, well, it makes sense. Also, when we're doing massage, we're doing shiatsu, we think about starting from the center of the body and working out, right? And there's a reason for that. And part of it is blood flow, right? We don't want to push blood toward the heart if we haven't opened up circulation. So it's a really important aspect also with GUA SHA, because we are pretty strongly, right? We're moving the blood and the lymph through the body. So when we are moving away from the center in one direction, it's pushing it out, and then it has the opportunity to return in a natural way without putting too much emphasis on the heart or too much strain on the heart. Please tell me I'm recording. Yes, I'm recording. Okay, so that's one reason. And the other reason, which I sort of came up with and theorized, because I do that a fair bit, is that in the olden days, the instruments might not have been that well refined. So if you were going back and forth with a tool that was rough, you could really chew up the tissues. Whereas if you had a tool and it was smooth on one side and you continuously went in one direction, the chance of you kind of chewing up the skin a lot would be less. So it would reduce the incidence of infection and tissue damage. Now, we don't really have that problem as much today, but you would be also surprised with some of these tools, even though they feel fairly smoothly. Some of them, there's still, very, very small nicks and perforations on the tool. So it still can really create some kind of damage there. So now, of course, if you're using stainless steel tools, that's not really an issue, but we're going to go into the strengths and the weaknesses of each of the tools in a little bit. Anyway, so I just wanted to touch base on the unidirectional piece, because that is definitely unique to GUA SHA. The other instrument assisted tools. Also, when you go back and forth over an area, you can really, it gets really raw and painful really quickly. So by doing unidirectional, you're spreading and moving the fluids and the blood more consistently. So IASTM, so this is the official definition of IASTM, is used to remove fascial restrictions and treat scar tissue and resolve adhesions. So using these tools creates an advantage over manual therapy due to the hard surface of the tool's ability to apply deeper penetration and more specific treatment to the affected area without further stress on the body of the practitioner. Promotes connective tissue remodeling through the resorption of excess fibrosis, as well as inducing repair and regeneration of collagen fiber. This results in the breakdown of scar tissue, adhesions, and fascial restrictions. So this applies to all of these techniques. So it is a good and very general description of what these techniques are doing from a more myofascial or superficial tissue perspective. Okay, and then we go into Graston therapy. So Graston technique, again, a trademark therapy, is a type of manual therapy that uses specialized ergonomic tools that massage and scrape the skin gently. So that's their official description. And the Graston technique uses a set of stainless steel instruments to help soft tissue injuries to the connective tissues, muscles, neurological tissues, and skin. It's effective for soft tissue injuries like repetitive stress injuries, strains, sprains, or subluxations. This soft tissue mobilization technique treats a wide number of conditions, including quadricep pain, rotator cuff pain, carpal tunnel syndrome, lower back pain, plantar fasciitis, tennis elbow, and even headaches. This technique has had proven results for patients. So again, this is a description that defines all three of the techniques, but as you can see, it's very specific to soft tissue conditions and injuries, which is good. And I don't know if has anyone here ever had IASTM or Graston technique? They're wonderful, wonderful techniques. So I can tell you my experience. So I studied GUA SHA for the first time. Like I said, it was 25 years ago, and I didn't do it very much at all. And then a few years later, I did another course in GUA SHA. A conference came around, and I did a training, and I got to ask the questions I needed to ask, and sort of satiate my curiosity and get more practice. So then I started to practice a little bit more, but it was still really only using it for this condition, like I was talking about, inducing the heat. So where a cold wasn't going away, but also I had two experiences to share with you. The first one with GUA SHA on myself was that I never used to sweat. I was one of those people that I would do exercise, I'd run, I'd, do all kinds of stuff, and I'd just get so hot, and my head would feel like it was going to explode. It would be so red. I don't know if there's anyone here who's had that experience, but it's incredibly uncomfortable. But I wouldn't sweat, like maybe a tiny little bit, but I didn't, when I worked out, nothing, I didn't sweat. And so when I learned about GUA SHA, I was like, I need GUA SHA. Let's see what happens. And so I did a treatment exchange with a colleague of mine, and she did GUA SHA, and she only did it on my forearms, on my triple warmer meridian, on my forearms. That's all she did. And about the fifth stroke, I started to sweat. I started to sweat just like that, like magic. It just opened up, and I can talk a little bit more about this triple warmer meridian and its relationship from the exterior and the interior of the body and all of that. But it was incredible, and I sweated ever since. Now I sweat. And sometimes I think it's, we have certain things that are a little bit constitutional that we have to work on an ongoing basis. So it is something that I will notice, oh, I'm retaining heat again. And, and so I'll do kind of a little top up of GUA SHA on myself every now and then. But amazing. It's also great for people who oversweat, right? So it's regulating the water passages. It's regulating the release of heat and the holding of heat in the body. That's one of the things that GUA SHA does that makes it special, really special. So it's also great, like I said, the end stages of the cold, and this partially, again, for anyone who's ever studied a little bit of Eastern medicine, you may know that the area around T1 on the neck is called the wind gate. And, I'm a naturally skeptical person. I'm the kind of person, I'm like, show me, prove it to me. And it's something that I started to observe. I'm a world traveler, and I started to observe in every single country that you go to around the world, except North America. People wear scarves. It doesn't matter if it's hot. It doesn't matter if it's cold. It doesn't matter. People wear scarves. They cover their neck. They instinctively understand that the neck is a vulnerable area of the body. And it doesn't matter whether it's hot there. It doesn't matter whether it's cold there. It doesn't matter whether it's windy. It doesn't matter whether it's humid. if you look around at different countries in the world, almost every single country in the world, people wear or carry scarves. And it's like this area of the neck. You know, I remember my mother, cover your head, don't go outside with your hair wet. And they used to say all of these things to us as kids. But of course, no one, and why not? Tell me why. If you tell me why, then maybe I will do it, right? Because I've always been that annoying kid who needed to know why. But actually covering the back of the neck, this area around T1 is the most vulnerable area of the body. And it's largely because, I mean, again, in Eastern medicine, all the yang meridians gather there. But physiologically, when you look at it, it's like the entire nervous system, right? All of the nerves that are coming up from the bottom of the body, all of the nerves coming from the neck and the shoulders, everything coming from your brain, like everything just kind of culminates in that area. So it's an extremely important area, and it takes on, you know, it's the area from where you think about your cervical spine or your neck, which is highly not protected, right? There's no bone, there's no large muscles that really protect your neck and your head. And then you come down, and then you come to these very large vertebrae, right? You come to the C7 and then the T1 vertebrae, which is very, very large. So there's a big shift in the body that also happens at the C7 T1 kind of junction area. Anywhere in the body where there's, you know, a big shift, whether it is in the shape of the body or where, just like, you know, just like the lower back, where, you know, the PSIS area is, and the L5S1, you know, these areas, they take a lot more pressure and tension as well. So there's many reasons why this area is a vulnerable area in the body. Anyways, wear a scarf. But so this is a great area, right, for treatment and for end stages of a cold, for neck pain. I don't know if anyone has ever woken up and had like, I can't move my neck. I'm sure you've treated a ton of patients like that, where it's like random. I don't know why. Maybe I slept on it funny. Maybe I had a strange workout yesterday. I don't know, but I just woke up and I can't move my neck, right? So gua sha is one treatment that can be done in this case that works incredibly well. So talking a little bit about the sort of functions on a Western perspective. So fascia, as we know, is connective tissue that binds and supports our entire body in compartments. So we have superficial fascia that is just below the surface, and it's covering, you know, the muscles, and then deeper fascia, which is covering deeper muscle groups and covering our organs. Everything in our body is just covered in layers and layers and layers of fascia. And as we're finding out, it's all connected. And in the fascia, again, now, of course, the study on fascia, when I studied anatomy and physiology, they barely even talked about fascia, barely talked about it at all. This is something that I've had to continue. And same with the lymphatic system. Oh my gosh, we hardly even talked about the lymphatic system 25 years ago, 30 years ago. So it's something that, you know, this research is ongoing. It's like in real time, we're learning more and more about the importance of these organs in our body. So the fluid that is traveling through the fascia and the connective tissue is called ground substance. And so now we're understanding that, you know, hydration, right, affects the ground substance. The viscosity of the ground substance is affected by inflammation. I've talked about this in my scars classes and all of my classes. If we're not properly hydrated, right, if our tissue doesn't have a good blood and lymph supply, then it atrophies, because the ground substance becomes so thick and granular and viscous that nothing can get through. And then that just gets worse and worse and worse and accumulates. So gua sha, cupping, these are amazing tools for getting the ground substance cleared and moving and helping get that cellular waste out into the bloodstream and into the lymphatic vessels and cleaned by the body, so that the nutrients, so that the more fluid can come in and nourish our blood vessels, our tissues. So this is a big part of the reason why people have pain is this viscosity in the fluids. And it's why you'll see, this is just a little tidbit for you guys. If you do good health history forms with your clients, I know some people don't do a lot, but if you do a lot and you see their list of medications, you may notice that almost all of your patients on, I would say, 4 or more medications, one of their main complaints is always going to be chronic pain, always going to be chronic pain. And that's because of this, because when the body gets on so many medications, it's the circulation slows down and there starts to be a lot more extracellular waste. The liver can't function the way it needs to help remove waste from the body. So these kinds of treatments can be extremely painful and can have a strong reaction as well. So we always have to be a little bit careful when we are treating people who are on long-term medications and whatnot, but it can be so helpful for them if we're gentle and we approach it with lots of care. Okay. So again, collagen fibers and fibroblast cells, which is, the building blocks of tissues, are also contained in ground substance. So that's the other thing, is when the ground substance is circulating, moving well, as well hydrated, then our healing process is also going to be better. Okay, so the action of GUA SHA, right, is we're always working one area at a time to completion before we carry on to another area. That's something I talk about and teach in the class. But we're going to see a gradually reddening of the tissues, which is called petechia. Okay, so these are now blood that is coming to the surface of the body. So people can be a little bit careless with the petechia. So I like to give people a lot of caution. We don't necessarily need to get petechia during GUA SHA. When you're working on the neck, you definitely will. And this is something that I say, the neck is actually a caution area. So this is not something that I would commonly support people doing in their treatments. But I just want to point out really quickly here, if you look at this image, right, you're going to see the dark redness, and then you see a general kind of red rosiness around the entire area, right? So that red rosiness is not petechia, right? That red rosiness is that histamine response. So that histamine response, which isn't as big in some people as it is in others, but it is a sign that the body's immune system has started to work. So as soon as you see the histamine response, you're already getting a positive impact from the treatment. That's what I wanted to share with you, because everyone thinks, oh, you got to get that red, but you're not always going to get the red. You're just not. It depends on the body area, the type of injury, and also the client's composition, body composition as well. So I'm just going to talk about the main similarities and differences of these 3 treatments quickly, and then I'll go into tools and whatnot. So all 3 techniques, they treat soft tissue injuries and pain. So they all do that. They all treat tendinitis and myofascial restrictions. They all move that ground substance, right? They all stimulate, even though they don't even claim to, they all do stimulate the healing response in the body. So that immune response. They all can potentially create petechia, and they're all instrument-assisted approaches. So now Graston technique is very specific patented protected tools, specific patent protected techniques. And because of that, or that's why, they can charge a lot of money for the training. So I don't know if you've seen Graston courses, but with the tools, I think they're somewhere around $2,000 US, which is a lot of money. And they're teaching, the techniques that they're teaching are, yes, okay, we're going to do this treatment for carpal tunnel syndrome, and we're going to do this treatment for this and that. Oh, I forgot about my Graston story. I talked about my sweating story and not the Graston story. So my Graston story. So in 2007, I, as a almost 40-year-old, I decided that I should play ultimate frisbee. I don't know if anyone here has ever played ultimate frisbee, but it's not something a 40-year-old should start playing. It's something that a 40-year-old should retire from playing. But it's just how I am. Anyway, so I played for a little while, and I went out on a cold November day and played and didn't warm up properly, and I blew my knee. I blew my
Okay.
Oh, somebody's got to mute themselves here. And my ACL, my MCL, my meniscus, the whole thing, it just went pop as I landed from a jump. And of course, I had to do, the full reconstruction and everything else. And as I was doing therapy to prepare for surgery, my athletic therapist, osteopath, said to me, you've got to strengthen your hamstrings. And the only way you're going to strengthen your hamstrings is by releasing your IT bands are ridiculous, which I knew they were ridiculous because I could never have like cupping on them or gua sha on them, was just excruciatingly painful. So at the time I owned a clinic, a fairly large clinic in Toronto, and I had a chiropractor working there, and he had studied Graston technique. So he said, all right, let's do some Graston. I said, okay, let's do it. And so he laid me down the table and put a rubber chicken in my mouth and started working on my IT bands with his Graston tools. And oh boy, I can't even tell you the pain. Like, it was so incredibly, incredibly painful, especially the first 3 to 4 sessions that he was doing. Back and forth, back and forth, back and forth, and back and forth, back and forth over my IT bands. And I swear to you, if I wasn't crippled with pain, if I didn't like him so much, I don't even know what I would have done to him. It was awful. He's like, don't worry, it'll get better. It'll get better. And we did 10 sessions, and my IT bands have never, ever gone back to the way they were before. Again, naturally, they want to be tight, but it's just never gone back to that. Like, he really, really worked well. And, but having said that, knowing now what I know then, I would have never allowed him to do that. We would have approached it a little bit more gently. And I still think that in the same number of sessions, we could have achieved the same results working more gently. And that comes from me, now knowing these techniques much, much better, and having 25 years experience. I have experienced repeatedly, many, many times, that you don't need to hurt people. You just don't, most of the time. Sometimes there is a little bit of discomfort or pain that can happen, should happen in a treatment. But once the body is at the point of resisting pain, there's no benefit to it anymore. Because as we know how a muscle fires, right? We know muscles do this, right? So if a muscle is pulling, right, resisting, you're not going to get any stretch out of it. So you got to get to the point where it does that, but then it's got to soften again. If it doesn't soften again, you can't get past that unless you let it soften, and then you can go a little deeper, and then you let it soften, and then you go a little bit deeper. And I don't understand how these people are so highly trained, right, in Western techniques, don't understand this. It's basic muscle energy. And it's the same thing with Graston. It's the same thing with IASTM. It's the same thing with Gua Sha. It's the same thing with cupping. It doesn't matter what technique you're using. It doesn't matter. It's the body. It's not the tool. It's the body. It's how the body responds. Now, what amazes me, I've spent a fair bit of time in Asia, and what amazes me is a lot of Asian, not everyone, but a lot of Asian people, and a lot of kind of older cultures, people are just able to relax into the treatment and allow it, and their body doesn't go into that resistance piece, then you can go deeper. But as soon as the body is going into that resistance piece, you're not going to get any farther, because like, oh, push harder, no pain, no gain, no pain, no gain. And it's absolutely not true. So anyway, so that was my Graston experience. And yes, and so he came and he had a beautiful case for his tools, and was very pleased with them, and I thought it was really beautiful. But I also thought to myself, well, I think he probably could have gotten all of that for probably $500 to $700. But anyways, good on you, and he did it very well. So that's the piece with gouache, or with Graston. And now IASTM came along after that, and they basically copied the tools, right, without the trademarking and everything on them, and made some of them a little bit different. And now, of course, you can order all of the same tools that you get with Graston on Amazon are much, much cheaper. The stainless steel tools are still much more expensive than the other tools, but they're worth it because they don't break, they don't scratch, they're easy to clean. Again, I'll get into that a little bit more, but you can use those tools on any of the techniques. It doesn't matter. So GUA SHA, we've talked a little bit about the differences already. And one of them being the inducing of the fever and the sweating in the body. One of them being treating the end stages of a cold. And then we're going to look at a little bit more in a moment as well. So GUA SHA was developed long before there was a real scientific understanding of the functions of the body. The ancients still understood the importance of moving blood away from the heart and the head to move fluids toward the limbs and to start at the center of the body. So the GUA SHA tools are non-specific. So you will have some practitioners like me that are more energy-based, energy-focused, that may share with you that certain stones, certain tools have certain energetic properties to them, and so they can be beneficial for certain approaches. And then you have other people that say, use whatever you want. You can use anything. You can use a jar lid. You can use a soup spoon, and you can. And you'll still get a result. It's just a matter of how much you want to refine the way that you work. So I'm going to just take a little pause here, and I'm going to just look at the chat and make sure I'm not missing. Teach me up. Stretching, exactly. Allow them to stretch. Issue pain. Okay, and that's right. I'm glad I have lots of people with a similar set of ideas about this. It was not gentle, it was a negative experience. Yeah, exactly. And yeah, I'm just reading this through quickly here today and trying to increase my understanding. Safe application, great. Yeah, great. Yeah, no, I always support a gentle approach. If those of you don't know about me in the past, for the last 8 years, I've been teaching a lot of cupping therapy. I started the cupping revolution in 2016, and it was also my goal to make sure that people were performing cupping safely, properly, not too strongly, following the indications and contraindications, cleaning their tools properly. And I just couldn't believe how many practitioners, again, the acupuncture community wants to say, oh, those massage therapists don't do it properly. And then the massage therapists, and then I see acupuncturists torturing their clients as well with it, and really, sometimes just going way too strongly as well. And so I think, there's a lot of perspective of this no pain, no gain ideology, and it just is not the way that I work. And I will tell you, in 25 years, I have incredibly high, incredibly good results in my clinic. And sometimes I barely touch my clients, right? The work can be highly energetic. It does not need to be strong and painful and torturous. Okay. Okay, so this is a list of some of the conditions that GUA SHA can treat. And so that top right corner there, musculoskeletal disorders such as frozen shoulder, neck pain, tennis elbow, lumbar disc problems. So that's basically that's the box that IASTM and Graston fits into. And then we have all of these other conditions which are considered indications for GUA SHA. So we can treat fever, bronchitis, asthma, respiratory infection, cough, throat infection, mastitis, autoimmune disorders, facial paralysis, head and face neuralgia, skin problems, cardiovascular problems, digestive problems, pediatric diarrhea, stress, insomnia, chronic fatigue, hepatitis. So some of you might be sitting here thinking, well, that's not in my scope of practice. Well, no, it might not be in your scope of practice, but these things may also not be conditions that your clients are arriving at your door complaining of because it's not in your scope of practice. So it could be a matter of one of those situations where you're able to help with these conditions without actually having to claim that you're helping with these conditions to your clients or in your client notes, but that if you have the knowledge and experience, it is an opportunity to just have a little bit more tools in your belt that can help your clients, because let's face it, you know, a lot of clients now, and what's not even on here is brain fog. Oh my gosh. How many people on this call have brain fog? Seriously. Hands up. I want to see it. Occasional, regular, hard to think straight. Headaches, sinusitis, fullness in your head. Yes, exactly. Exactly. And how many of you it's gotten worse in the last 3 years? Right? So I have the killer treatment for brain fog using GUA SHA on your head, like immediate, instant clearing of the brain fog. And it's so good. Just totally clears your head. So just one example, fullness of the chest. You can hear me. I'm a little bit wheezy. I don't know if you can hear that. Maybe if you haven't heard me speak before, you may not be able to hear it in my voice, but I have congestion here. So this morning I'm there and where's my GUA SHA tool, digging it out, and I'm doing a little bit of scraping on my own chest, try and clear up my lungs. I got that because I'm allergic to mold. And I think that's part of the reason I got sick last week, because I was exposed to a moldy place. But all of these, you know, all of these conditions, why hepatitis? Because we're improving liver function, right? If we're improving blood and lymph flow, we're going to naturally, without even doing anything specifically, it's going to help with digestion. It's going to help with cardiovascular. It's going to help with hepatitis. It's going to help with our sleep, right? A lot of these conditions by proxy are going to improve, and a lot of conditions by intention will improve. Right? So if we're working on an area body, and we're working on this today, and this is something that not a lot, I don't know how many people here believe in intention in your work, but it's part of the reason why I study everything, because I believe that the more you know, the more you can do. The more you know, the more you understand that you don't know as well. And so then it's like, ooh, you know, I just touched on this, and what about that? And I find that using intention in the work is way more powerful than muscle. So this is something that if you don't think about something as it may help this, that, or the next problem, it's not going to be in your mind when you're treating them. But if you know that they have digestive problems and their mid or lower back is sore, and it just so happens that the nerves for the digestive organs attach in the mid lower back, and that there are meridian points or acupoints in that area of the body, and you know that, then when you're setting your intention on the treatment, you may know that their back pain may have more to do with muscles, more to do than with the muscles, but it may actually be something that's happening internally in the body. So this is where having just, again, it's like cracking open the door a little bit and seeing all of the possibilities that we simply don't study. I mean, we know this in Western anatomy as well. We know the nerve that innervates the liver attaches at T9 on the back. Like, we know this, right? We've learned this, but we just never understood the importance of it. Very important. So we're going to talk a little bit about the tools now. So in Eastern medicine, in ancient times, the materials that the tools were made of were considered very important. And so I gotta move along a little bit here. And so when there was a pain or inflammation type condition on the body, so kind of injury, heat and inflammation, we want to apply a cold tool. And so the coldest tool in the ancient times was actually a yak. Is that right? Yeah. But we couldn't use that because they're rare, like they're rare animals, and the water. Anyways, so now buffalo horn is considered the second coldest tool to treat. So if you're treating inflammation and heat, buffalo horn is a very good choice of tool, because it's going to be cooling, and it doesn't hold heat. It doesn't absorb heat as you're working as much as some other tools like a stone or even metal. Rhinoceros horn, that's what it was. Sorry, it says it right there. So they used to use rhinoceros horn. So obviously we don't approve of that at all. So buffalo horn would be the next coolest tools. So buffalo horn is a great tool to use for heat and inflammation. And then we look at the different types of stone. So jade is considered a harmonizing tool. So it is cooler in nature. So it's more like conditions of the liver, like irritation, people who are, maybe a little bit more controlling or have mild muscle pain. Jade can be a very good tool. And because it's harmonizing, it can be used on the head, right, for head pain and aches. And it's very, very nice for that. Whereas rose quartz is considered the love stone. So it vibrates with our healing energies. So it's very good for using on the face. It's very soft feeling. Like when you touch the stone, you have it on your skin. It just has a warmth about it that feels stabilizing on an emotional level. So personally, I use jade tools on the head. I use rose quartz on the face, and I use a little bit of jade on the body. I use buffalo horn, and I also use I have stainless steel tools as well. So when we talk about stainless steel, so the stainless steel is cold and hard in nature. It's inflexible, right? They're thick, they're hard, and they're heavy. So this has a good and a bad side. The good side to it is actually it takes very little pressure to use these tools when you're applying them, because the weight of the tool is already creating a lot of pressure, right? The downside to that is that it's easier to injure someone with these heavy metal tools. So, and the other downside to the metal tools is that because of the thickness and the heaviness of it, they're not as sensitive. So you don't really feel what's happening under the tissues as much as you do with the other tools. And that's probably why it appeals more to physiotherapists and chiropractic and manual type therapists, where they do quicker treatments. They're not so much body workers where they're used to feeling, like we spend our time, right? We spend our hour, 2 hours feeling the body. And so you don't get the same feedback from the metal tools as you would the softer tools. Another upside to the stainless steel is if you clean them and disinfect them properly, you never have to really worry about them unless they get real damage to them, that they are cleanable and disinfectable kind of, fairly indefinitely. So even though they're a lot more expensive, they do last longer. And then we have, the good old shiny soup spoon, which works in a pinch. If you've got a soup spoon in your cupboard, you've got a jar lid, you can do your scraping techniques with those tools, but you just have to be really cautious that there's no chips or nicks in the tools when you're using them. A soup spoon is actually a wonderful tool. It's got a beautifully rounded edge. You can get the ceramic ones, and always I say any tool that is created from nature is going to have a better impact on the body. So I always like ceramic more than plastic, but the plastic tool, again, less chance of breaking. Although I've had my ceramic soup spoon this is my ceramic soup spoon that I got 20 years ago, when I studied GUA SHA. So, if you take care of them and you wrap them, I have little bubble wrap sleeves that I put them in, and I've kept them forever. So you do have to watch the surfaces of the tools, and whether it's glass, stone, plastic, whatever the material is, you always want to watch for nicks and cracks. And as soon as you start to see nicks and cracks, you have to replace them. And not only because they could damage your client's skin, but they can also hold bacteria and infection. And you're not necessarily going to get it out when you're cleaning and disinfecting the tool. So it's really important to inspect your tools very regularly. So just a little talk on safety, right? So it's not a sterile procedure, especially as soon as you're getting that redness, right? That petechia on the surface of the body, then that's considered an interruption of the surface of the skin. Now, technically, as massage, it's questionable at the scope of practice level. So you really want to make sure that you're using high level disinfection if you're creating superficial petechia on the body. If you're not creating superficial petechiae on the body, like when you're doing facial gua sha, then you don't have to worry so much. A low-level disinfectant is totally sufficient for cleaning tools. Personally, I have a high-level disinfection set up in my clinic, and I put everything through it because it doesn't harm the tools. So why not, right? You may as well just be safe. Okay. So contraindications, so any kind of break in the skin, wounds, sores, pimples, outbreaks, any skin condition, you're going to avoid it with gua sha. Geriatric patients, you have to be careful, or people who have been very ill, right? The skin can break and tear very, very easily. People who have difficulty healing wounds, so sometimes a diabetic neuropathy or any kind of advancing diseases, immunocompromisation, you just have to be a little bit careful. Pregnancy, you want to be careful over the abdomen and the lower back, although it says contraindicated, it's really not contraindicated, it's more of a caution. Recent injuries, so if there's already existing bruising or abrasions, until the surface has closed. So there could still be some marking under the skin. As long as that petechia has healed up, you're okay to treat again. So I will say one thing, gua sha is safer than cupping when you're looking at deep level cupping, right? Because deep level cupping is moving the tissues as much as 4 inches under the surface of the body. So you have to be much more careful when you're talking about cardiovascular conditions, any blood flow conditions, conditions with the organs, or any autoimmune diseases and whatnot. So to be honest with you, I'm using more gua sha than I've ever used in my in my career, simply because deep cupping just, it makes me nervous. I don't know who's running around blood clots anymore, right? They're saying COVID causes blood clots. They're saying vaccines cause blood clots. They're very small blood clots, so they're not showing up necessarily. People are on blood thinners and are not really thinking anything of it. They're not telling us what medications they're taking. People have long COVID, right? So I've been extraordinarily careful with my own cupping practice, and I'm using, for the medium to deeper treatments, I'm using more gua sha, and I'm using cupping more for myofascial type treatments. That's unless I'm doing bloodletting, so which not a lot of you are acupuncturists, so it's not in your scope of practice. I definitely have started to use a lot more bloodletting because that can actually help to heal and treat blood clots. So just to touch base quickly on gua sha for the head and face. So again, this is a beautiful treatment for stimulating collagen, helping with fine lines and wrinkles. It's amazing for defining the face. Great, gua sha on the head. Yeah, I used to do a lot of facial cupping. I still do, but I do also facial gua sha. It moves the lymph, right? It perks up, brightens your eyes, but gua sha in the head is amazing. So I have, I've created online courses for both gua sha for the body and gua sha for the head, face, and neck. And they can be standalone courses, but I'm also going to show you guys, I have packaged up all of this material for you today if you're interested as well. So we're going to talk about that in a minute. So it's really important to communicate clearly with your client. Please, before you do these treatments, let your clients know about what's going to happen, that they may have marks before you ever start treating them. Get their consent. And also, I have also created a separate consent form for clients before I do cupping and gua sha, so that they understand these things may happen. What's normal, what's not normal, what to do if a blister, a rash, all of these things happen. So it's really important to keep your clients informed. The number of people who will not let me do these treatments on them because some other idiot treated them and didn't tell them they were going to do it, and they thought they were injured. They thought they were messed up afterwards. They were terrified. Or they went home and their husband went, "What's on your back?" And they're like, "What? I don't know." Right? And they looked at it and they had these marks and they had no idea. It's the worst thing. You might have given a brilliant treatment, but you didn't tell them. And they didn't know. So freak them out. Right? and then they never want to have it again. And sometimes it's the best thing they could possibly have had, but that opportunity has been lost for them. So please, please, please communicate with your clients. And it can be traumatic. Some people really don't like the sight of blood or that redness, right? So you need to help them understand. Also, palpating afterwards, checking for areas of tenderness, right? And just having a look at the body when you're finished. Show them the result. Go to the dollar store and get a little mirror and just say, see, this is what we did here, before they leave your office, right? It may change a little bit. It'll probably change over the next 2 to 3 days, but I just wanted you to see it. As far as I'm concerned, this is perfectly normal. If anything, if you have any questions, just let me know, right? And that way you're not going to cause any kind of problems that way. Okay. All right. So this is what we've got. So I have an online course for GUA SHA, and of course, I talked a little bit about GUA SHA today. Why the GUA SHA course that I've created is a little bit different is because in the course, I talk about GUA SHA in general, the courses you're going to take, they're just going to teach you how to do it, right? They're just going to teach you the techniques. They're not going to teach you ways to do it that are very specific. For example, in this course, you get a bonus if you do the face. If you also purchase the face course, I have a 20 potent acupoints of the head, face, and neck, so that you're not just doing a cosmetic GUA SHA treatment, but you're learning about these acupoints for treating headaches, for treating brain fog, treatment on the lower leg to treat headaches, right? To treat conditions of the head and the neck, assisted stretching with GUA SHA, dynamic movement. So it's a full body treatment where you're moving the body into specific conditions again. So you're getting a little bit of muscle stretch. So you're not getting that same pain that you get from just applying the tools. A little bit of meridian therapy and manipulation. Talking a little bit about, for example, when we talked about inducing the sweat with the triple warmer channel in the body, the gallbladder meridian, which is absolutely the #1 meridian channel, along with the bladder channel that you're going to treat with GUA SHA, because it is the wood element. So when we say we have to chop the wood, right? So when we're using these tools, this is a very effective way to chop the wood, right? And these channels are related to the muscles and the tissues. So when we are treating these specific acupoints and specific meridians, the body just softens up a lot more quickly. So I talked to you a little bit about muscle energy techniques as well as soft tissue techniques. So it's a little bit more than just GUA SHA. As I go through the training, I teach you little bits and pieces as we go along, treating different areas of the body just to get a little bit more effective results. Okay. And so that is the body treatment course. What happened here? Is that right? Yeah. So like I said, I've been doing this stuff since 1997. And really my mission, I have a lot of practitioners who are teachers or whatever, and they say, you shouldn't give away so much free training. You should charge for everything you do. You should get paid for everything you do. And they're probably right. But if I could have be like in the old days where the emperor just gave his healer a bag of gold and he just treated everyone for free, that would be a perfect world for me, right? Like, to me, as long as I have enough to do everything I need to do in this life, then I want to try to get people as much information as they possibly can, not only to help more people, more clients, right, to get better results, but also for you guys. Because as far as I'm concerned, if you're not a healthy practitioner, you can't possibly do great treatments. And you're going to be a healthier practitioner if you're working more efficiently, more effectively, but also if you're following your true pathway, right? And I think a lot of people are practicing this work and they feel like it's kind of a slow torture for them, right? They're exhausted. They know there's more to it, but they're not really finding it. They're not really getting there. And I'm not saying everyone is supposed to jump on the Eastern medicine bandwagon. That's totally not what I'm saying. But I think that this work resonates for a lot more people than they realize, because they go, oh yeah, well, that makes sense. I have a headache on the side of my head. You don't know until you try it. But if you ever have had a headache on the side of your head and you work on your lower leg, you'll see it. The results are instantaneous. And so these little tools and tips and techniques are things that they help you in your practice, but they're going to help you, right? They're going to help you be more healthy. They're going to help you be more effective. They're going to help you feel more connected to your work. So this is why I do what I do, right? This is why I coach people. This is why I'm online endlessly answering questions with people and trying to get it better. Because let's face it, our healthcare, I don't care where you are in the world, healthcare is sickness management. It's not healthcare, right? They don't care about your health. They care about making money. They care about creating medicine for people so they can make more money. They don't care about making people better. They care about people relieving symptoms. We are the people who can help people, right? And so I really think that we, are a special tribe of people. And the best way that we can make the world a better place is by helping better, helping more. And so this is what I do. This is what I love to do. I'm passionate about it. I love sharing this stuff. I love bringing in that Eastern and Western perspective and taking the meat of it, right? And helping people in their practice. So I'm putting all my courses on sale till Monday. That's it. And because you guys attended the webinar, you guys, well, I'll tell you in a minute, actually. But so the basic Gua Sha course is Gua Sha of the body. It's 5-hour CEs. It's all video training. I teach all areas of the body, all the techniques, all the history of Gua Sha, the differences, the tools. I go into a lot more detail. I talk about, what tools, what shape of the tool is something I didn't even talk about. It's such an important piece. Right? So it's an online course. You study at your own pace. You get PDF notes. I'm available to answer questions anytime. So I've thrown that on sale for $199 because I love you guys. So yes, they are approved for CEs. I have them approved in several provinces in Canada, and CBTMB has approved them as well. So this is a $199 investment. So it's very reasonable. And then I've combined the full body and my head, face, and neck course together, which is a 10-hour course, including the bonus 20 potent acupoints for the head, face, and neck, which is $79 value. I have the what I call the 4 directions treatment for the head. So this is for headaches and brain fog. It's all included in the course. I still study at your own pace. So all of this, the value comes in at $560. So I'm selling that at $279, which is normally the regular course of my Gua Sha course standalone. So that is the best deal going for sure. And then, or if you're not interested in the body course, I have simply the head, face, and neck course available, also on sale, also including the 20 potent acupoints for the head, face, and neck, which is $79 value. And I'm selling it for $149. So that is the situation that I have going here. And so now I'll continue to answer the questions. So yes, all the courses are approved for continuing education credits. It depends where you are. So I've applied for most provinces in Ontario and NCB, in the US. And of course, if there's anywhere in New York State, I didn't do because I just had a little issue with my own governing body here in Canada. So I wasn't able to get approval this time around, but I certainly may go ahead and do that next year. The scalp treatment can take as little as 2 minutes and as long as 20. So it really depends on how extensive you want to go with it. Was the book you mentioned from Ari? It's called Gua Sha. It's that's the name of the book. So I'm just going to go ahead and I'm going to show you. Okay. So let me just move down here. I want to make sure that I got everything in from this here. Okay. So just realized this says on Sunday at midnight. It's going to be Monday at midnight because I realized it wasn't enough time for people to be able to watch the replays. So this is what the sale looks like. And let me just go. So this is the sales page here, as you can see. So it is a signature course. I don't know anyone else that's offering these techniques in their Gua Sha training. Usually you have to go out and take, the other kind of courses to go along with it. So not that I'm doing extensive meridian therapy, extensive acupressure, any of that, but it's all relative to the treatments that we're performing in the course. So this just talks about, what we're treating and how it's different. So feel free at any time, you can unmute yourself or ask any questions that you like in the chat. The training basically at this point is finished, and I'm going to just complete asking any questions that you have in case I missed anything, in which case I'll try to make sure that shows up in tonight's training. So these are your 3 options.
Can you, Lisa, it's Nina. Can you use the Gua Sha on the lamina groove? I've been working with someone who's an acupuncturist in Canada, in San Diego, and she said that the professor in China she's working with talked about being able to flush the lamina groove out, and that's really helped people.
Yeah, I mean, there's no area of the body that is contraindicated for Gua Sha. So anywhere that you're already doing manual therapy, you can apply Gua Sha to it. You just have to be careful, obviously, if you're using the tools over tender tissue areas or bone, right? You just have to, and that's where I wouldn't use a stainless steel tool on an area like that, right? I want to use a little softer tool and just work in gently. And of course, the firmness of the tool is going to, again, if you're working with a soft touch, it's going to get you in those areas more than maybe your hands can get in there and just sort of clean it out, right? So yeah, I think so. Nice to see you, Nina. So clean your bone or stone. Yeah, I use Sporox to clean. I use 6% hydrogen peroxide, but that's what Sporox, that's what Sporox is made from. So that's the my cupping course in April is located in Ottawa. That's another subject altogether. And someone asked earlier on about teaching live classes. I do teach a little bit live, but I'm moving a little bit away from teaching live courses. It's really, it's quite difficult to travel and teach. But if someone does have, if they know they have a group of people, then for sure they can reach out to me, and we can certainly have a conversation about that. Gua Sha is great for neuropathy. Yeah, it's really good. Yeah. Thank you, Kylie. I appreciate your warm comments. That's wonderful. Okay. Would facial treatment be good for rosacea? Potentially. You have to. I mean, rosacea is one of those things that can be a little bit complicated because rosacea tends to be a situation where there's more blood vessels coming to the surface. So obviously we don't want to cause damage to that, but there is a specific treatment for rosacea. It's in my facial cupping course, and the same thing would apply for facial Gua Sha. So when you're treating rosacea, you actually want to try to bring the blood down out of the face and out of the head. So what you would be doing is you would actually be doing some body treatment before you ever touched the symptomatic area on the face with rosacea. You have to be quite careful with that. Yeah. Any other questions? All right.
I just want to mention one thing for those of you who haven't taken any of Lisa's courses. The way she does the demonstrations is absolutely excellent. You will see all aspects of it. I find it actually better than having her right there, because you always have someone blocking you. This way you get to see all the different angles. And my clients, since I've been doing Lisa's work, have told me that they like the massages better than before I used the Chinese techniques from Lisa. So I really highly recommend this work.
Oh, thank you, Nina. That's so kind of you to say. I'm touched. Ah, make me all teary. Okay, great. Any other questions? Good. Yes, please feel free. If you know anyone, there's another training tonight, so they can still sign up for the training tonight. And even if they miss or they can't make it, I will send out the recording. So this will go out to anyone who's signed up for the training, so they'll have the opportunity to see the course. So thank you so much. This was wonderful. I went a little long. I thought I was going to get this all in an hour, so I apologize for anyone who had to go. But hopefully, if anyone who had to leave, hopefully you're able to catch the rest of the training through the recording. So like I said, you can sign in tonight as well, absolutely. And if you register for the classes before the end of Friday, you're going to get this bucket of tools sent to you. And if you register after Friday, you won't. And that's as simple as it is. My warehouse has been instructed to stop the shipping. Well, we're going to stop the shipping of the tools when the tools are all gone, to be honest with you, but you'll get a certain amount of tools now, and then I'll do a little bit of a flash at the end for anyone who gets in as an early adopter. So it's wonderful. Thank you so much for showing up and taking the time out of your day. And yeah, so if you come tonight, I look forward to it. And if not, hopefully we'll see you in the Gua Sha course. You're always welcome to send me an email and ask any questions as well. All right. All right. Well, enjoy the rest of your day. Thank you so much.
Thank you.